In this presentation, we are going to talk about environmental policy and regulations. Increasingly, protection from environmental associated health hazards is regarded as a fundamental human right. Policymaking will need to take into account the reduction of disparities in health status that result from environmental sources. Momentum is gathering for the development of policies that protect the health of vulnerable population groups, such as children, who may be even more susceptible to the actions of the environmental toxins than the adults are. Good policy decisions can be made if data on the economic costs and benefits of the policy package and its components are available. The environmental policy process takes place within political context and reflects tension between political considerations and the scientific knowledge that is available. In some instances, the public may reject environmental policies that are justified scientifically. An environmental policy is a statement by an organization, either the public or the government, of its intentions and principles in relation to its overall environmental performance. Environmental policy provides a framework for action and for the setting of environmental objectives and target. The goal of environmental policy is to reduce human risks or environmental damages resulting from pollution. Policy analysis facilitates social evaluation of these risks and damages by clarifying the costs of reducing environmental damages in terms of foregone economic returns. In the environmental health arena, there are multiple principles that have to be considered when developing policy. This includes precautionary principle, environmental justice, environmental sustainability, and the polluter pays principle. A significant ethical issue for policy developers involves setting an acceptable level of risk associated with a potential environmental hazard. There needs to be a moral consensus regarding the level of risk that is sufficient to regard a substance in the environment as a potential threat to human and ecologic health. The precautionary principle states that preventive and anticipatory measures should be taken when an activity raises threats of harm to the environment, wildlife, or human health, even if some cause and effect relationships have not fully been established yet. The concept environmental justice denotes the equal treatment of all people in society irrespective of their racial background, country of origin, and socioeconomic status. The presence of an environmental hazard may be the end product of disparities of power and privilege within a community. Consequently, unequal toxic exposures of adults and children from different racial, ethnic, or socioeconomic groups may occur. An example is children who reside in minority communities may receive especially high exposures to different environmental toxins. As a goal of environmental policy, environmental sustainability adheres to the philosophical viewpoint that a strong, just, and wealthy society can be consistent with a clean environment, healthy ecosystems, and a beautiful planet. The three components of a sustainable development are materials and energy use, land use, and human development. Environmental sustainability means that resources should not be depleted faster than they can be generated. The concept also specifies that there should be no permanent change to the natural environment. A crucial aspect of any environmental policy concern is who should bear the cost of eliminating the environmental hazard. As defined by the Organization for Economic Cooperation and Development, the polluter pays principle means that the polluter should bear the expenses of carrying out the pollution prevention and control measures introduced by public authorities in member countries to ensure that the environment is in an acceptable state. The policy cycle refers to the distinct phases involved in the policy-making process. The policy cycle comprises several stages: the problem definition, formulation and reformulation, agenda setting, policy establishment, and policy implementation and policy assessment. All 5 parts of the cycle are here, with answering who or what group may be responsible for carrying out each action. I will leave a few minutes for everybody to review this table. There are a number of agencies and entities that are involved in keeping the environment safe and also concerned with health impacts from the environment. The World Health Organization is a major international agency that is responsible for environmental health at a global level. It provides leadership in minimizing adverse environmental health outcomes associated with pollution, industrial development, and related issues. At the national level, many countries have a federalist system of government. The concept of federalism implies a type of government that is structured around a strong central government with specified authorities retained by lower levels of government, such as states and local governments. The situation characterizes the United States, where a legislative and judicial branch of government performs important functions in environmental policy formulation. The Congress of the United States retains significant responsibility for creation of environmental laws. Judicial bodies in the United States support interpretation, strengthening, and enforcement of those laws. At a national level, many government agencies regulate environmental health hazards in their respective countries. An example of this is in the United States, the Environmental Protection Agency is responsible for protecting human health and safeguarding the environment. With the United States, individual states and local governments also maintain responsibility for the control of environmental health issues. Examples of agencies involved in environmental health regulation include Department of Natural Resources, Department of Environmental Quality, environmental protection agencies at state and local jurisdictions, integrated waste management boards, energy commissions, public utility commissions, state and local health departments. Examples of federal level agencies that may be assisting with environmental health and impacts are the United States Environmental Protection Agency, the National Institute for Occupational Safety and Health, NIOSH, which is an agency that conducts research and makes recommendations to prevent worker injury and illness. The Agency for Toxic Substances and Disease Registry, ATSDR, is the nation's public health agency for chemical safety. The agency's mission is to use best practice, take responsive action, and provide trustworthy health information to prevent and mitigate harmful exposures to toxic substances and related diseases. The National Institute of Environmental Health Sciences, NICE, is one of 27 institutes of the Centers for the National Institutes of Health. It supports a wide variety of research programs directed towards preventing health problems that are caused by our environment. It has grant programs, in-house laboratories, and the National Toxicology Program. There are also a number of environmental advocacy organizations that you may find at the federal, state, or local jurisdiction. Examples of this are Greenpeace, National Resources Defense Council, National Wildlife Federation, the Sierra Club, the Union of Concerned Scientists, and the Nature Conservancy. There are a number of U.S. and environmental health laws that we saw on the last slide that we should note. The Clean Air Act was in 1970, which is the comprehensive federal law that regulates air emissions from stationary and mobile sources. The Clean Water Act of 1972 established the basic structure for regulating pollutant discharges into the waters of the United States. The Safe Drinking Water Act of 1974 was established to protect the quality of drinking water in the United States. The National Environmental Policy Act of 1969 was one of the first laws ever written that establishes a broad national framework for protecting our environment. The Federal Insecticide, Fungicide, and Rodenticide Act provides for federal regulation of pesticide distribution, sale, and use. Toxic Substance Control Act of 1976 provides EPA with authority to require reporting, record keeping, and testing requirements and restrictions related to chemical substances. The Resource Conservation and Recovery Act of 1976 gives EPA the authority to control hazardous waste from cradle to grave. Occupational Safety and Health Act of 1970 is to ensure worker and workplace safety. The Endangered Species Act of 1973 provides a program for the conservation of threatened and endangered plants and animals and the habitats in which they are found.